Babies not surviving past infanthood. It's a tough topic to talk about. Since 2004, the Pioneer Valley has consistently had higher infant mortality rates than the rest of the state. Springfield is the worst among the 30 largest communities. What's going on? Who is this happening to? And what's being done to stop it? To answer those questions and more, I'm joined by Julie Skokesberg Pimental from Project Baby Springfield. It's a working group of Springfield's Department of Health and Human Services. Julie, thanks so much for being with me here today. So tell me, what is Project Baby? What do you guys do?
So Project Baby is a working group, essentially. We fall under the Maternal and Child Health Commission of the city's Health and Human Services Department. And it's really a group of volunteers. We're made up of folks from a variety of different professional backgrounds. Our director, Dr. Andrew Balder, is a pediatrician. And we have nurses and social workers and community outreach folks within academia, with early intervention, behavioral health. It's really across the gamut.
And what exactly does Project Baby do in Springfield?
So our overall mission is healthy babies, healthy mothers, healthy families. And we have the slogan that we believe every baby deserves a great beginning. So we're looking at the overall health of babies, mothers, and families.
What would you say are the leading causes behind infant mortality?
So that's a great question. So infant mortality, which we're just coming off of September, was Infant Mortality Awareness Month. Now we're in October, which is SIDS Awareness Month. Infant mortality itself is looking at the death of an infant from birth to 1 year of age. The leading cause of death for infant mortality in the United States are what we call congenital malformations, which is a fancy word for birth defects, and prematurity, being born too early and too small. And the third leading cause is SIDS, the sudden infant death syndrome, which now you might also hear referred to as SUID, which is sudden unexpected infant death. Those are the three leading causes. After 1 month of age, SIDS is the leading cause of death among infants. So most babies die from birth defects or being born too soon. But after 1 month of age, between 1 month and 1 year, SIDS is the leading cause of death.
And why is Springfield the leading cause in infant mortality, one of the largest cities in Massachusetts to deal with this? Why Springfield?
That's a complicated question. It consistently Springfield ranks, and that's not a statistic we necessarily want to tote around, right, or highlight in a necessarily a positive way. But consistently, the city ranks, as you mentioned in the opening, we have the highest infant mortality rate among the 30 largest communities in the state of Massachusetts, and that is an average of 2008 to 2010 data, with 2010, as I mentioned earlier, being the most recent data available. And there are a number of factors, and we can't pinpoint just one. Okay, so that's in part what makes this so difficult. And so when we look at SIDS, for example, so I'll just talk about that since it is SIDS Awareness Month, we were able to see that in terms of Springfield specifically, and this is based on data and referrals from the Massachusetts SIDS Center in Boston, that when we have of the number of infant deaths, so the deaths from birth to 1 year of age in the city of Springfield that are attributed to SIDS, of those, 60%, about 2/3, have to do with a sleep environment. And that's what we refer as an unsafe sleep environment or an unsafe sleep position. So babies suffocating, having their breatheway obstructed in some way, So having to do with sleep. And so over the past year, we have been engaged in what we call our safe sleep efforts. So right now we have our safe sleep campaign, which we developed with Natalia Munoz from Verdant Communications, focused on issues of safe sleep. So the posters are on the outside and inside of PVTA buses running around the city, and will be up for the next 3 to 6 months.
Would you say that sleep position is the biggest reason of infant mortality?
Not of infant mortality, but of SIDS.
Okay. And that's a big part of infant mortality.
Yes.
So sleep position.
Especially after 1 month of age, then it is the leading cause. And it's also the most tangible thing that for those of us in public health, broadly the public health field, can address in terms of educational campaigns, outreach, and just a little background in terms of work on this issue. In the mid-90s, the federal government had this whole Back to Sleep campaign. When they started putting babies to sleep on their backs, the SIDS rate declined more than 50%. So we saw a significant decrease, more than 50% decrease in infant deaths once we started to put babies to sleep on their backs.
So you guys recommend putting babies to sleep on their backs, not their stomachs, because I know that can be a very, one generation says put them on the back, the next generation says put them on their stomach, and then it almost flip-flops back and forth, and you never know which way is the right way. Now talk about any other leading causes behind infant mortality.
So the leading causes are birth defects and being born too small and too soon.
Okay, and what are some messages that you guys are trying to get across to the public to prevent those from affecting infant mortality rates?
So our efforts this year have primarily been focused on safe sleep efforts. And as we are starting to look forward in terms of planning ahead, we're now looking at ways in which we can address those larger issues. We have certainly larger goals to address those issues in terms of working with the provider community. So whether it be the midwives, the nurse practitioners, the nursery nurses, the OBGYNs, whoever is providing preconception care, prenatal care, and postnatal care in terms of mother, and not just the babies, right, but also the mothers, because the health of the mother, particularly when we look at issues around preterm birth.
Let's talk about ethnic disparity. I know you guys had mentioned on your website, it talks about the African American rate is 2 times the white rate. The Latino rate is not as high as the African American rate, but because of a higher Puerto Rican population in Springfield, it affects the city more. How are you guys trying to reach out to different minority groups to make them more aware of what's happening and what they can do to prevent this from affecting them?
So what we see in Springfield in terms of, and you're right, so the African American rate is twice that of the white rate. Sometimes in the 2009 data, it was 4 times the rate. In the most recent data, 2010, it was 2 times the rate. It fluctuates, and because we are a small urban population compared to the larger cities, that happens sort of naturally. And the Latino rate is also higher than the white rate, but not as high as the African American rate. The African American rate, I'll address that first. Consistently, whether it's in Springfield or we look nationally, that is true across the board. And so that starts to raise a number of questions in terms of what I call sort of some structural questions about the society and the community that we live in, and really forces us to look at some of those larger macro level questions. In terms of the Latino rate in Springfield, I refer to that as a little bit of a false positive, even though it is higher than the white rate. But the numbers are so small, but when you break the Latino rate by ethnic group, so the largest ethnic group in the city of Springfield among Latinos is Puerto Rican. And nationally, the Puerto Rican infant mortality rate is much, much higher than other Latino ethnic groups. So we know, even though because Springfield's so small, we don't have it broken apart by ethnic groups, that in a way, when we lump all Latinos together, we're getting a little bit of a false positive. But if we were to break it apart, our guess is that you would see the Puerto Rican rate much higher than the other represented ethnic groups, Guatemalan, Mexican, Dominican, etc.
What can be done to stop it? How can people get involved? What message do you guys want to get across to change this?
So that's the $1 million question, and it's a big question. And one of the things that we like to emphasize is that it takes all of us, right? It's not just about focusing on moms or just focusing on prenatal care. It really is a holistic, comprehensive approach to care, and also requires us to look at the kind of society that we live in. So addressing the structural issue of racism, for example, and the impact of racism on people's health. And there have been tons of studies done documenting the chronic stress of everyday racism on people's health. You can't simply reduce it to racism. I'm not making that argument. But that we need to get real honest in terms of the society that we live in and ask some pretty tough questions of ourselves. Access to care and quality of care is another area that needs to be addressed. And so one of the things we continue to sort of ask for are community champions, folks that are going to, work towards reducing the infant mortality rate in Springfield. And the most, concrete effort we've made thus far, because as I said, we're a group of volunteers. Of the whole time we've been together, we've had funding just for this past year. So we are not a funded group. So this year we had funding, we got 2 grants, one from the March of Dimes and also from the Children's Miracle Network at Bay State Children's Hospital. And so with those funds, we were able to hire a coordinator, which is me, and then also consult with a multicultural marketing consultant, Natalia Munoz from Verdant Communications, to help us develop safe sleep materials. But infant mortality is much broader than safe sleep, but that is oftentimes a good starting point and a way for us to outreach and educate within the community and start that conversation that needs to be started.
And that's the whole purpose. Well, the Project Baby organization is in its infanthood, and you guys are hoping to bring it to a much bigger stage and try to get as many people involved as possible. Julie, thanks so much for coming on board and talking to us about this.
Thank you.